Anxiety, schizophrenia, depression, bipolar disorder, post-traumatic stress. More than 42 million Americans suffer from mental illness each year, and 1 in 5 children in the U.S. have poor mental health.
Really, the term should be brain illness instead of mental illness. It's difficulty, an illness that comes from the brain that affects mental or emotional well-being. It can affect the way we think, the way we feel, the way we concentrate, and the way we interact with others. Unfortunately, one problem in children is that the recognition is often very delayed. Often children don't know what they're experiencing. Many times they are viewed as behavioral issues, behavioral disorders, children who are just bad. The face of a child who's depressed often is an angry child, behaviorally acting out child. So it's not recognized that this is a child who is sad. Many times an anxious child is a child who will refuse to go to school, or a child who will refuse to go out and play or interact with others.
I'm Sharon Townsend. I have an 11-year-old son named Damien, whose official diagnoses at this point are ADHD, severe oppositional defiant disorder, bipolar disorder, dysgraphia. We call it anger issues and ADHD. Technically or officially, his classification is emotionally disturbed.
Historically, most families have just dealt with the mentally ill at home. The state of Mississippi provided asylums for the seriously mentally ill away from the public starting in the late 19th century. In the mid-20th century, asylums were closed and government-funded community health centers were opened, but the state hospitals located in 4 areas of the state still serve those with serious mental illness. Community-based treatment for children from therapists, psychologists, and psychiatrists is available in outpatient settings like an office. It's also available in inpatient settings like acute care facilities and long-term residential facilities for children.
If a child has more than a case of mild ADHD, quality mental health care can be difficult to get in this state. Emotional disorders, there really isn't a set support group in this area for that. Most of the help is geared toward people with physical disabilities, not emotional disorders. If you have a child who has true emotional disorders, you're basically on your own, especially when you have one like my son who's extremely intelligent. People tell me all the time, I don't see it. So then the parent ends up looking like the villain because I don't see that. I just can't believe that child is like that.
In a study by the CDC, approximately 8% of adolescents aged 12 through 17 years reported more than 14 mentally unhealthy days in the past month. Experts say not dealing with mental disorders a child has can lead to deeper problems in their teen years. Some teens develop mental disorders, drug and alcohol abuse, self-harm, and suicide are among them.
My name is Kevin Hines. I have bipolar disorder type 1 with psychotic features, and in the year 2000 I survived a jump off of the Golden Gate Bridge in an attempt to end my life. It's the worst day of my life, and in some ways the best, because I lived, I was able to recuperate, find recovery with living with a severe mental illness.
Kevin was 19 and been battling mental illness for 2 years. He was seeing a psychiatrist after having a mental breakdown his junior year of high school.
Because I was in such great denial. I was seeing a psychiatrist, I was talking to therapists, I was going to these places, and I was pretending to be okay.
Kevin, now in his 30s, takes his story to mental health professionals around the country. He says part of the problem was not following his treatment plan.
Part of it was that on the weekends I'd binge drink until blackout while on psychiatric meds, something that could have killed me. Another piece of it was this great denial. I don't have this, I don't want to have this, and I played football. I was a champion wrestler. I was on the speech and debate team. It didn't make sense, so I hated it.
You have your kids that are having minor symptoms of depression, anxiety, which of course may run through the family. Family genetics always plays a toll as well. Then you've got the kids that on the severe end of the continuum that are receiving services from multiple agencies that even before that had risk factors that put them in place to have mental health problems, issues anyway.
We asked families of young children, what are you experiencing? And it was children at risk for mental health challenges. And they were saying that their children had some really significant problems and they wanted to get them help. But first of all, no one believed that children that young could have problems. And then they had a lot of fear that by saying that, my child's having these problems, I don't know what to do when he won't go to bed and he's staying up all night or he's, throwing things in stores all over, that their child was gonna get taken away from them because people would look at them and say, well, you're just a bad parent, and that's the problem. And in reality, what they were needing was help that would really address that child's needs. And it's not about labeling a child at that age. It's about identifying symptoms that we know if we treat them early, they're going to go down a better path than they otherwise would have.
It may be something that you were born with. It may be, for example, in the area of depression, some individuals just don't have enough of the neurochemicals. Serotonin is a big offender. They don't have enough of that to make them feel happy most of the time. It may be that it doesn't become apparent until they're older. Some of the mental behavioral disorders occur early in life, but many of them start presenting around puberty and then in the late teen periods.
I noticed when my son was 2 that he was different. I saw him kicking. I saw him butt head into a wall. And by the time he was 5, he was angry enough to talk about burning the school down. And I started trying to get help. I cried for 2 weeks because I've dealt with bipolar people, and I knew that it was not going to be an easy road, and it hasn't been.
Parents, and especially moms, tend to automatically kind of have this guilt gene where they blame themselves for everything that happens with their child and always second guessing themselves. And then if there's mental health challenges on top of that, it's very easy to blame oneself even more and start second guessing everything you do and think, well, maybe I'm not spiritual enough, maybe I'm not trying hard enough. But then oftentimes when parents do try to find help, the first questions they're asked sort of imply, well, what did you do?
My name is Pat Montgomery, and I have a child that was diagnosed with schizophrenia at the age of about 17.
Ryan was a good student, an avid runner. He was an artist, a band manager, and in the choir. But after the death of his older brother in a house fire and the death of his father, Pat started getting concerned.
At the very first, he had an issue in the choir. He had gone on a choir trip and separated himself from the choir, and that was very unlike him. Then he had trouble in school. He was having problems focusing in school, and his teachers were telling me that he was sitting in class and they didn't really know what he was doing. And when I started talking to him about it, I discovered that he was hearing voices, and that's how we found out. It was really scary. He wasn't able to keep up in school. We had a meeting with his teachers, and we kind of got on the same page, and we tried to get him in an education program where he could get his GED. He wasn't able to finish high school, and he had quite a few hospitalizations between the time we found a good treatment for him. We put him on some antipsychotic medicine, but none of the medicines that we tried worked. I worked in mental health, so I thought when this happened, I thought, well, this is gonna be easy. I did feel like I would know what to do, but I didn't know what to do. I was just going from person to person, because it was like, the way that I felt, if you can imagine, a woman with her hair on fire running down the street just saying help. That's how I felt, and that's what I was doing. I was talking about it to everybody that would listen.
It's not a cookbook, cookie cutter, one size fits all type thing. You want to tailor your treatment to the individual sitting across from you, because he or she's a unique person, and you need to do good work to find out exactly what's going on with that individual and then fit the best treatment possible to him or her. For instance, treating children with ADHD, attention deficit problems. The standard go-to gold treatment is a combination of cognitive behavioral therapy and medication. And the results you get by putting them both together are much better than treating with either one alone. I wish there was a blood marker for it. You could draw blood and see if someone's depressed. I wish that it was visible on an MRI. There's the tumor, cut it out and it's gone. It's not like that, because you're dealing with the brain, and it's a much more complex organ. And so what we try to do with a lot of folks is give them the tools within expectations that they can live a healthy, productive life.
I was talking about it to everybody that would listen. And one day, he had been gone for a few years, and we had been on all these, he had been in a day program, he had been in hospital a number of times, and I'd asked everybody if they knew who could help me, and I just happened to be talking to one of the psychiatrists at work. I called her and I said, I know I'm playing with my son's medicines. I know I shouldn't be doing it, but I'm desperate. Because, Ryan was just sitting in one place. Oh. And she didn't fuss at me.
Pat Montgomery, whose son Ryan was diagnosed with schizophrenia, says it took a few years to get the right help, going from doctor to doctor, from medication to medication. Eventually, electroconvulsive therapy made a difference.
Initially, he was in the hospital for his first few treatments, and you could tell how tortured he was just by looking at him. It was really scary not being able to help him. But after his first set of ECT treatments, he had his 7-year-old smile was back, and we hadn't seen him smile in a very long time. And he didn't remember any of the horror that he had been through for all those years.
Entrance into behavioral health care, mental health care, is confusing, disjointed, and disconnected. And that's not just in Mississippi, that's nationwide.
The children typically aren't going to ask for help, so it has to be the parent who is able to step through and be able to realize that the best thing they can do for their child is to ask for help.
Advocates say some mental health care providers, including psychiatrists, psychologists, and therapists in Mississippi, accept insurance assignment or Medicaid.
The good thing about our community mental health centers is that whether that person is indigent, has Medicaid, and many of them do, or have private insurance, the community mental health center will not turn them away.
For families in a mental health crisis, taking the child to a hospital emergency room can be a last resort.
Usually individuals who go to the ER are at imminent threat to harm themselves or others.
When this occurs, a doctor at the hospital will determine if the child needs to be hospitalized. Depending on the age, the child could be admitted to the hospital or to an acute care psychiatric hospital.
The emergency department is one entrance there. The problem is, where do you go after that? A lot of these kids will then go to an inpatient unit because they are deemed to be a threat to themselves.
Acute care typically is 2 to 3 weeks, depending on what the insurance will agree to. So the insurance companies actually decide what the children need, not the physicians, not the therapists, not the parents, but the insurance companies.
Sharon's son Damien was diagnosed with ADHD and bipolar disorder and entered the system through a community mental health center at age 5. Damien's mental health problems have been treated in acute and residential care settings and at the state hospital.
After 2 years at home with Damien, his behavior started to escalate. He was taking stimulant medications. His moods were getting worse. I thought that keeping him at home, staying at home with him, was in his best interest because I did not want to send my baby away.
Sharon said her son wasn't sleeping, was angry, and was exhibiting antisocial behavior.
Oak Circle is the state hospital for children, the state mental hospital for children. Damien went to Oak Circle on November 15th of 2013. He stayed there 3 months, and he went to Mill Creek about February, and he came home November 18th of 2014, so about 9 months.
A child's entry to Oak Circle at the state hospital is through a chancery court commitment process. Even though Sharon retained custody, the state hospital personnel made the decision of when to release him.
That was the hardest thing that I've ever had to do in my life, was to sign those papers, because he has been, and he is, my world.
Xanax, Depakote, Adderall, Concerta, Zoloft, Thorazine. These are just some of the psychotropic medications used to treat mental illness in children, such as depression, anxiety, attention deficit hyperactivity disorder, bipolar disorder, and psychosis.
There is no specific treatment that we can say, you've got schizophrenia, this is the thing that's gonna fix it. We don't have that like we have for diabetes, for other organ illnesses. It's trial and error. And you have to stay on a medicine for so long before you even get a glimpse of whether it's going to help.
These drugs do cause weight gain, and they can lead to pre-diabetic states, increased blood sugar, insulin resistance. You can also have lipid abnormalities where your blood fats go up, which can lead to heart disease later on. All the problems associated with obesity. You still can get movement disorders. So we don't use them lightly. It's got to be fairly serious before we'd go to an antipsychotic. And unfortunately, antidepressants don't work in the younger kids. They may work in the teens somewhat, but they don't tend to work very well in the younger kids. It's always risk-benefit with medication.
The thing about psychiatric care for children, in my experience, is that the psychiatrists, even though they're knowledgeable, don't have a lot of time to talk. Psychiatrists, their job more or less ends up being to give them pills. In Damien's case, medications, the stimulant medications, make him more violent.
My name is Dawn Mackey, and I have a 9-year-old son who has been diagnosed with ADHD and ODD, which is oppositional defiant disorder. He had trouble relating to other children in his classroom. It seemed that his communication skills were a bit above theirs, and it was really frustrating for him to try to talk to them and be on their level.
Dawn says she took Mark when he was 4 years old to his pediatrician first to get help. He was tested and diagnosed. She says they started working with a counselor and psychiatrist, but she says it wasn't a good experience.
I felt like there was just a real push for the medication without really listening to what was going on, and it was a very, very busy practice, and I just kind of felt like parents were taken in one door and pushed out the other, and that I really wasn't listened to. I was talked down to, I was disrespected. I didn't want to have a 4-year-old that was already medicated. I would say even at that time, I wanted to research what are the tools that we can use? What can we do besides instantly pushing a pill on this child?
She says she went to 2 more mental health specialists before feeling comfortable about Mark's treatment.
And again, I really was worried about having my child on medication. The child was, I guess, 6 years old maybe whenever we first started. And I remember asking him, how do you feel when you take your medicine? How does it work for you? And he says, I get less annoyed with people. People don't make me so mad. We've actually seen that just in the short time he's been working with this therapist. And he's able to step back and take a breath and not react.
With mental health challenges, a lot of times we tend to think those are about bad parenting, when in reality they can be about a lot of different things. And a lot of times, almost all the time, parents are doing the absolute best they can with their children, but that child may not respond to the typical types of behavioral interventions and all that other children do because they think differently and their mind is different.
A lot of children and youth, and maybe even some of the parents, but more so the youth and young adults, they don't want to go to a mental health center. They don't want to be seen at one. Especially if that mental health center has a bad reputation as far as that's where all the crazies go. Or either I saw you walking near there, you know, are you crazy? Are you going to see, they don't want that. They don't want, the stigma that's associated with being seen there. So it is difficult for those children and youth that's their only option.
People are not aware of it, or their immediate pushback is, well, it's just bad behavior.
Another barrier I faced was people saying that I was raising him wrong. It's my fault. I'm not strict enough, I'm too strict. He's a school teacher's child, so he shouldn't do this, that, and the other. You're not doing what you're supposed to do. Another obstacle has been family thinking that it would be better just to sweep it under the rug and nobody know.
Fighting the stigma of mental illness has really been an issue where people that can get the help refuse to get the help. And you have seen that in the African American community quite a bit, and we're working on changing the way people view mental illness.
Inevitably, someone will walk up to me and say, I have bipolar disorder. I've been diagnosed, but my parents don't believe it's real. What do you do when you go to school every day, you see a psychiatrist, you have a counselor, and they're telling you this is what's going on, they're prescribing you medication, and you go home and your dad or mom says, snap out of it.
And usually what happens if they don't get the care that they need, especially in time, sometimes people will take their own lives, they'll take the lives of others, or they'll live in a dark, dark place for many years.
Brad Taggart, a handsome, tall young man. He was from a good family in Madison, Mississippi, the son of Andy and Karen Taggart. He was a student at Ole Miss and loved to hunt and fish. His father says he was good at just about everything.
A maddening combination of charming, boyish joy and attitude. And that really does describe him. He was 6'7", plus a fro on top of that, so he looked like a giant everywhere that he went. Mischievous, sarcastic, bold in adventure, sort of the leader in his group of friends.
And without warning, Brad committed suicide. Andy remembers when Karen found Brad that summer day.
She had come home about middle of the day to pick up Brad for a doctor's appointment that they were going to together, and found him lying in the front yard of our home by herself, with a handgun beside him. We never knew Brad was in trouble, either with drugs or with mental illness.
Brad left a suicide note in which he described his drug use and his mental decline.
I hate that I'm putting you through this. The last thing I want is to bring you all grief, but I cannot go on living any longer. I've lost my mind due to drugs. Drugs have robbed me of my memory and knowledge that I've gained. I spend the majority of the day staring off into space. I've fallen into a psychosis. My mind has taken over and I can't control the voices in my head. My anxiety is set off by the slightest bit of discomfort and it overwhelms me completely. I sleep all day, not necessarily because I'm tired, but I hate being in reality. My drug use started out with just weed, which didn't have anything to do to affect the state I'm in now. It really started to go downhill just under a year ago with LSD. I began using it regularly. It was a way that I could escape into an alternate reality, one that was euphoric and free of problems. I also began using mushrooms, MDMA, cocaine, and nitrous oxide. My view of reality was skewed by drugs. It started to become difficult to control the negative thoughts in my head. I began to notice the negative consequences that the drugs had on my brain. I didn't know it then like I do now, but I was slipping into the psychosis that controls me now. I have no hope, no reason to continue on. I've ruined my mind, my brain, and my life. Mom and Dad, you are the best parents I could ask for. This is 100% my fault. You could not have done or not done anything differently to make this not happen. I love you. We think we would do our spiritual enemy a great favor and the world around us a great disservice if we refuse to read that and let people hear those truths. It's quite clear from what he relates to us in his note that he did, at least at the end of his life, suffer at least from mental illness caused by his substance abuse. One of the great alarms that we want to sound to people is that we had no objective evidence of that. He and most kids his age was very sophisticated, and he chose to live a parallel life for a year that we didn't know about and his brothers didn't know about. And consequently, we do not believe he was suffering from any sort of mental illness that he didn't induce as a consequence of his substance abuse, but clearly was at the end of his life.